my philosophy of care is really based on looking at the patient from a holistic standpoint. I'm very interested in understanding what their social situation might be like, where they live, what stressors they may have, because all of those things can impact their ability for self-care. And so it's not that I can fix all of those issues, but if I have an understanding of it, then I know that I may need to tweak some of my treatment plans or develop a relationship with them and assist them in navigating those which may be barriers to accessing further care or even obtaining medication. So I do try to include that in each of the visits that I have with my patients. My areas of special interest or expertise are really in chronic disease management. So I have a strong interest and have done extra practice in seeing patients with diabetes, hypertension, hyperlipidemia. And for those who may not be in the medical field, that's seeing patients with high blood pressure who have high blood sugar and have high cholesterol, and really working with them in establishing a treatment plan that they can follow to help improve the outcomes related to those disease processes. I think patients should choose MUSC for their health care because we are first and foremost a group of caring individuals who are here because we have the mission of impacting the lives of the patients that live in our area. In addition to that, there's a lot of innovation that's going on at MUSC in regards to treatment of those chronic diseases that I've talked about before. And we really have multiple centers of excellence to address cancer, diabetes, chronic diseases, and we understand what's happening in our community and some of the roadblocks that patients may have to overcome to improve their health outcomes. So for me personally, I also have a dual role of being a nurse practitioner faculty member. And so one of the areas that I tie into my love of chronic disease management is that we have actually started a couple of free clinics throughout the area where we specifically focus and target on patients who have chronic disease. And we try to educate our students in an interprofessional manner so that we have physician students, nurse practitioner students, undergrad nursing students, and even pharmacy students engaging with patient populations that have chronic disease to try and improve their outcomes, but also see what it feels like to work on a team and to work well together on a team. And so that's one of the things that specifically I am doing to combine both my educator role and my practice role in improving patient outcomes.